Emergency rooms are profit centers. Startling new numbers on the cost of a simple procedure like getting stitches could run you thousands of dollars. Here with more, Dr. Celine Perec, a professor of orthopedic surgery at Duke University. Doctor, thanks for coming in tonight. I cannot imagine why it would cost you thousands of dollars to get stitches. What's going on?
Well, remember, emergency rooms tend to be the most, one of the most expensive places to get your health care. And so if you have a smaller, non-urgent issue, you will pay more. You also need to remember that there are really four things that go into the cost of your bill when you go to get care at an emergency room. The first is the actual services that you get for your specific need. The second thing is that that hospital or health system takes care of underinsured patients or Medicare and Medicaid patients.
Right. Well, let's get to that. Let's talk about the costs first, because I think we have to define the problem here. And let me tell you, it is big. I'm going to give some examples here. California Pacific Medical Center charges $2,229 for 3 stitches. New York's Lenox Hill, I've been there, hospital, $3,355 for 5 stitches. Jacksonville, Florida hospital, $2,000 for 3 stitches. Mercy Hospital in, I believe, Miami, $3,000 for 6 stitches. This is unbelievable. Now, you made the point that, hey, you shouldn't be going to an emergency room for this. That's a mistake. But look, I might get injured in the middle of the night. My primary care physician is not hanging out in his office waiting for me to come to him. So at the end of the day, it's not my fault. It's the system's fault. Why are they charging so much for this?
Well, absolutely. So sticker shock is going to happen. But again, you have to keep in mind that when you go to a hospital, an emergency room, you're not only paying for your own services, but you're also paying for the fact that that hospital takes care of Medicare and Medicaid patients and underinsured patients where the hospital loses money.
So they charge me more because they can get it from me. Is that it?
Well, well, absolutely. The cost of the loss from caring for those patients has to be basically equalized amongst all the patients and borne by all the patients.
Not equalized, transferred to people who have deeper pockets. And frankly, that's not necessarily even me. That's my insurer.
That's correct. That is correct.
You know, this is interesting. Here are a list of hospital costs from a hospital called the California Pacific Medical Center. X-ray of heart arteries, $32,000. If you have a procedure to remove your gallbladder, $25,000. This is the one that gets me. A codeine pill, $20 at this place versus 50 cents at Walgreens. Are they just hoping we'll never notice this? I mean, because anybody, frankly, who looks at their bill closely could see this problem and complain.
Absolutely. And I think what the hospitals are trying to do is to bring more transparency to the issue, because there is sticker shock, there is inflation of the prices, and so there are things called charge masters that you will start getting after you get your care through these health systems, and you'll start being able to see the itemized bills and how the prices are so dramatically different. Now, the hospitals are trying to contain costs in a variety of different ways by going to the pharmaceutical companies, the biotech companies, the medical device companies, the suppliers, and trying to negotiate cheaper pricing from them. They're also trying to decrease readmission rates. Absolutely. It is a big problem.
It's a big problem. Dr. Perec, thanks for coming on tonight.